Now on your feet at 5, just ahead of the holidays, we are seeing a rise in COVID cases. Today, 6,100 were reported overnight. That's 1,700 more than yesterday.
Also, Betsy, our latest positivity rate is over 14%, and that's nearly 3 times the WHO's recommended threshold of spread. They say it's around 5% before you can really kind of rest easy, at least temporarily. And while those are certainly numbers we have to keep our eyes on because they are on the rise, our senior health correspondent Monica Robin says the important numbers that we really need to focus on now are hospitalizations. And Monica, of course, joins us now. Monica, good evening to you. They're not just up. I've been looking at them every day. They're really up.
Yeah, Isabel brought up a great point, though. She said, compared to where we were last year, but the problem is it's looking like Delta may be getting a second wave. So we are seeing a very disturbing trend heading into the holidays. Ohio has nearly 3,300 people hospitalized with COVID right now. This is the 5th day in a row we've topped 3,000, and it keeps increasing. Now, we haven't seen hospitalizations this high since October 18th. Some believe the Delta variant getting a second wind, or more likely, it's probably people gathering indoors because the temperatures have dropped. What's more concerning is 1 in 5 ICU beds in the state of Ohio have a COVID patient in them, and those needing ventilators also going up. The vast majority of those in the hospital are unvaccinated, and that's why health officials are urging people to at least get tested before you head to Thanksgiving dinner. And like Isabel said, there are places you can get those tests for free if you go to the state's COVID dashboard.
Well, over the last almost 2 years now, we've seen all kinds of shifts in the way things are done and access and all of that. There was a rule that was put in place during the pandemic that might be going away, but that rule is important because it actually provided easier access to medical care.
Yeah, it's really important for people who live remotely, who may not have a lot of money, because in the beginning of the pandemic, state and federal governments actually eased privacy and security restrictions on telehealth and made it easy for those hard to reach patients who don't have access to Wi-Fi or smartphones, or maybe they live out in the boonies somewhere. It made it difficult for them to talk to doctors just on the phone, audio, not even FaceTime, including they could talk to doctors out of state. Now, those rules will expire at the end of the year. So if this impacts you, now is the time to reach out to both your state and federal lawmakers and let them know what you think. For some, an extension on this service could be life-saving. And believe me, this is happening across the nation. So about half of the states have already put in some parameters. Ohio did extend it over the summer just for a little longer, but it goes away at the end of the year. So hopefully we'll see some change.
It's made a huge difference for many.